roll call for the Rio Grande Council Government's Board of Directors meeting, which is today, July 25th, 2025. We did start at 11:08 Central Time. And so virtually, the individuals, our board members that we have virtually participating are going to be Sheriff Oscar Ugarte in a vehicle. Look at that. That's a commitment right there. We also have Judge Carlos Urias with Culberson County. We have Mayor Cruz, City of Socorro. We also have Leonard Wells, our liaison for Fort Bliss. And then we do have Representative, City of El Paso Representative Josh Acevedo. And we also have Board Trustee Leo Hanani with El Paso Independent School District. And then we do have our legal counsel, Diana Valdez, present. And we could do our roll call from in person here if you would like to start, Commissioner.
Commissioner Ileana Holguin.
Lily Limon. Curtis Evans. Art Fierro. Andres Renteria.
Jackie Butler.
Manny Baeza. Greg Pennington.
Joanna McKenzie.
Great. Okay. And then in terms of our guests, we'll just go ahead and quickly virtually, we do have staff with us. We have, I believe, Rebecca Stallworth is online with Rio Grande Council Governments. We have Judy Cisneros. We also have Chandler Mills from Commissioner Butler's office. And I believe, and then we'll hear a presentation from Mario Arenas with GRP. We do have a presenter, Marisela Tavares with Recovery Alliance. And then in person, Lynette Brem with Big Bend Hospital District. We do have our presenter, Ms. Melendez, Leila Melendez with Borderplex Workforce Solutions. We have Peggy O'Brien with Rio Grande COG. We do have Marisa Quintanilla, our Regional Services Director, Julissa Cisneros, our Administrative Assistant. And then we also have Yvette Lugo, our AAA Director. And then Cristobal Guzman, right, Cristobal? Okay, I said it right. And she is with Commissioner Butler's office as well. And I believe that is everyone, if I hopefully have not missed anyone. Okay. So our first order of business are the approval of the minutes from the May 30th, 2025 board meeting. Commissioner Holguin, I will be requesting if we can table this agenda item for next meeting, which will be on September 5th, and we'll present those at that time.
Yes.
Okay.
We have a motion and a second. All in favor?
Aye.
Motion carries. We'll go ahead and move on to agenda item 3, public comments. We do have public comments from Yvette Lugo, our AAA Director. She was not able to have this on the agenda, so we know we won't be able to have discussion, but we definitely want to make you aware of what is coming up with one of their initiatives under the Area Agency on Aging.
Thank you. Good morning, board members. Thank you so much. As Annette shared, this was kind of hot off the press that we put this event together, and so not able to get onto your agenda. But I did want to make this announcement because we will be out in the region again with our benefits counselors. And for those that are not familiar, our benefits counselors are those staff that are just looking at and are certified through the state health insurance programs to talk about Medicare, Social Security, questions people have about benefits. And so that's their specialty, and they're certified to do that. And so part of their mission is also to educate the community. And of course, our region is important as well. And so we've put together 3 dates that we will be out in this part of our region. August 13th, we will be at the Jeff Davis County Library with, and it's an educational presentation about navigating Medicare. So I think sometimes we put that off, or people don't realize the importance of understanding your Medicare benefits, when it's important to take that, or just really grasping an understanding of what that entails. And so we're hoping that people will come out and join us, even if it is just to learn about your own benefits or those people that have questions, because they will be doing the presentation as well as being available afterwards to answer questions, sit with one-on-one. People sometimes maybe don't want to share some of the concerns they might be having with their benefits. And so we'll be at the Jeff Davis County Library August 13th, the Marfa Nutrition Center on Thursday, August 14th, and that's in the morning from 9 to 10, and then at the Alpine Public Library that afternoon from 2 to 3. And so we'll be out here for 3 days, but you are always welcome to call us. I know that sometimes it's hard to connect and make sure that we're in El Paso, but we are here to serve the entire region. But just wanted to make you all know that, especially those that are from here can take that information back. I've got posters, I've got some flyers if you'd like that at the end of our meeting. Happy to give and distribute that. And always grateful to Peggy for being our liaison out here. We appreciate that support, but just wanted to bring that to your attention, and we'll be out here in a couple weeks. Thank you.
Thank you.
Okay, so we'll go ahead and move on to finance. And our first agenda item is to approve and accept the annual audit report for fiscal year ended September 30th, 2024. And we do have Gibson, Reddick, and Patterson here to present the audit to everyone. Just as some background information on, let's see, on July the 16th, we did have our finance committee meeting, and Mr. Mario Arenas with GRP gave that presentation. It was more in depth. So today's presentation will be more of a brief summary to capture what was evaluated, and he'll be able to answer any questions you may have. So Mario, I'll turn it over to you.
Thank you, Annette, and good morning, board. First, I want to mention that our firm greatly appreciates working with the COG another year. And same as in prior years, we've had a smooth audit, a smooth process in the audit, and that's for the reason that there's a great management team at the COG. They answer all our questions, they answer all our requests in a timely manner and get back to us. And that would include, of course, Ms. Annette Gutierrez, Yvette Lugo, Lorena Estrada with AAA, and then, of course, Judy Cisneros with Finance and all her wonderful staff, and also Marisa Quintanilla with Regional Services, and also Ms. Rebecca Stauffer with, we have some questions that always go out to her, and she always very wonderful in getting back to us, so thank you. So to start off with the audit, the first thing I want to mention is that it was an unmodified opinion, meaning it's a clean opinion. There's no issues, there's no findings or any other required communication to be reported to the board. And yes, Annette is kind of flipping through all that in the audit report if you wanted to look at in detail, but I just kind of gave you the brief summarized version of that. No findings, no issues, no required communication to report to the board. And then we do have some slides that we have prepared just to give you the very quick and concise financial highlights of the year. So to start off, the first graph that we have is total revenue for governmental funds. And you'll see that in total, there was an increase from 9.9 million from 2023 to 11.4 million in 2024. And that was related to your grants, as you can see there on the blue bar graph. That's where the majority of the increase took place. And that was mainly due to two reasons. Your fiscal year 2024 was the last year of your art monies under HHSC, so that played a factor into it. And then in your CSEC program, there was also a special project completed in 2024 for the flyover services for the 911 program. So those were the big contributors to the grants. And then there was also some other decreases that offset that, which one of them was mainly your Homeland Security grant that was used to purchase law enforcement equipment that was done in the prior year. And then this year in 2024, you had a little bit more to use up and kind of close that up. The other items, your program income and in-kind, that also increased because of HHSC. It had a better program participation. And then your other two categories, charges for services and other, were pretty much the same as in prior years. And then the next graph that we have for you is the expenditures for governmental funds. So this is the other side of the coin, kind of the money's going out. And it's pretty much kind of the same picture of it. You'll see that aging or your HHSC grants makes the majority of it because that's one of the largest grants. And similarly had an increase on the expenditure side. And then, as I was briefly mentioning, with your emergency communication and your 911 program, that also had an increase due to the flyover services project that was completed in the year for 1.2 million approximately. And then your other categories were pretty much on par with prior years, except for water quality. You can see that's the light blue on the bar graph. That typically varies from year to year as it is dependent on what phase of the project it's taking place. And then our next graph that we have is for your governmental fund balances, or your, you pretty much, we also refer to them as reserves. So that is made up of two components. You have restricted, non-spendable, and unassigned. So the restricted, the blue part, that is, as the name implies, it is restricted to certain programs such as the Dispute Resolution Center and the Far West Texas Water Planning Grant. And that also had an increase of roughly 55,000 due to the activity in the Dispute Resolution Center. And then the orange part of the bar graph, which you could probably see a lot better in the next graph, because the next graph pretty much has the same thing, just the unassigned portion of it, the orange, that is from your general fund, and these monies can be used up for they're not tied up to anything like your restricted fund balance. These monies can be used up by the board as determined, or by management as approved. So you'll see that there's been a constant increase in fund balance, a little bit each year. The COG doesn't have a lot of room to increase fund balance significantly in the general fund because it's tied into the general memberships, which are, they're not large proportion to the operating expenses. So it is a good sign. It is a good indicator of their financial health that fund balance has been maintained throughout for the last 5 years, and in some cases had some significant increases. And then the next slide that we have is your revenue, but this is for your enterprise funds. And you'll see that this is made up of two categories, your expo revenue and your contract services. And to start up at the top with your expo revenue, the yellow portion, that's the annual expo event that AAA performs every year. And you'll see that back when the pandemic was at its peak, there was no revenue. That's because the event was canceled for 2020 and 2021. But ever since then, it's been kind of building up to pre-pandemic activity. So this year was more comparable to those times. And then the blue section of the bar graph, the contracted services, that also had an increase due to some new contracts that were available for the COG to take on with Presidio and Del City. And then the last graph that we have for you is your enterprise fund net position. So these are the reserves that we just talked about, but these are for your enterprise funds. And similar to that, these monies are unrestricted. Pretty much management or the board can use them as for any need as they decide or approve. And similarly, the fund balance or the net position has been maintained for all these years, or in some cases had some small increases, which again, that's a good indicator of the COG's financial health, being able to maintain their fund balance or reserves. And that's the brief presentation that we had put out for you, so you could kind of pick up, we could give you the financial highlights for the year. And of course, if there was any questions or on any of the numbers, or you wanted me to go in detail, I'll be more than happy to answer any questions.
Mario, can you go to slide number 2, the pink portion, other? Can you give us more detail on what makes up the other category?
Yeah, so these are your smaller grants that don't have their own category, like criminal justice. These are sometimes like one-time grants that the COG has from 1 year specific. So for 2024, those were specifically, let's check here. Let's see here.
I believe they were like our State Energy Conservation Office grant.
Yes.
The
Mhm.
Workforce Solutions. So those are the ones that are, they don't have a category to fit with the other larger programs. And so
Mhm.
they're bunched in the, under the pink category.
And they can change from year to year.
Yes, and those are the ones that will have they have more of an end date than the others, because these have been traditionally funding sources that we receive on a yearly basis with the others, but these are potentially one-time projects.
Okay.
Yes, thank you, Annette.
Mhm.
Does anyone else have questions for Mario? Nope. No, I think that's it, Mario. I think we need to take action to
Thank you.
accept the audit, correct?
Yes.
Okay, can I have a motion to accept? I have a motion and a second. All in favor? Aye. Motion passes. Thank you. Thank you, Mario.
Kudos.
Thank
All
you,
right, thank
Mario.
By the way.
Thank you. You all have a
Yes,
great day.
great.
Thank you.
Great job, great job.
Okay, well, that'll take us to 4.2, and this is receive a presentation on the Public Funds Investment Report, third quarter for accounts held at Wells Fargo for fiscal year 2025. I will be as brief as I can on this agenda item. We are required to provide you with a quarterly report on our business activities. And so our first one is to talk about, present to you all our checking account, our overall operating account that we utilize. So there was a market value increase of 52,721 between our expenditures and our cash advances during the third quarter of fiscal year 2025. And as of March 31st, 2025, the market value was $1,658,666. And the book value, as well as the market value as of June 30th, 2025, is $1,711,387. And we do see an interest earned for this quarter of $6,742. For the next account that we want to acknowledge, that's for the commission, State Commission on Emergency Communications for 911. And there was a market value decrease of 225,000, 254,000. And that will be the difference between the expenditures and cash advances for this third quarter of 25. As of March 31st, 2025, the market value was 326,741. And as of June 30th, 2025, both the book value and market value is 101,487. And this did earn interest of $271. The last account to talk about is the TCQ, that's the Texas Commission on Environmental Quality, our solid waste program. And so the market value decrease did show a decrease of 29,681, and that was being the difference between the expenditures and cash advances during the third quarter of FY 2025. As of March 31st, 2025, the market value was 156,347. And both the book value and market value as of June 30th is $126,666. And this did earn interest for the quarter at $239. Are there any questions for me?
Fund that's not the largest amount of money in it. What is the collateralization in excess of the FDIC limit?
Judy, can you hear that question?
Okay, I did not hear it.
Would you mind saying that again, Judge?
What is the collateralization of what type of collateralization is in place above the FDIC limit?
Okay, so for the FDIC, it's the 250,000 per designee. So in this case, it would be all of the person, I guess anybody who has access to the account, which would be the officers from the board, as well as Annette and myself. So it's 250,000 times 5. And then the difference that we have is being collateralized by the Bank of New York.
That's my question. The difference between 1.6, 1.7 million and 1.2 million is collateralized by what?
Let's see.
Okay. Tell me again, Annette, I can't.
The difference between the 1.5 and the 1.7, what's being collateralized?
So, okay, so then
Yeah.
Wells Fargo will pledge every day at the end of the business day. So they usually pledge what they think the amount of the balance in the bank would be. They usually try to go a little bit higher, and that's on Wells Fargo. That is an amount that changes daily. The difference, they collateralize that on a daily basis on the remaining funds above the 1.25 million that is being covered by the FDIC.
And is that treasury bills, line of credit? What's the collateralization is my question.
So currently it is Pennsylvania Treasury. So it's, to be honest, it's bonds, treasury bills. So anything that is government funded or requested.
That's all I have.
Thank you.
So it's not, you're not buying stocks. It's usually just being collateralized by the same bank, governmental funds.
Thank you, Judy.
You're welcome.
Did that answer your question, Judge?
Yes.
Yeah.
Okay, no more questions? All right, well then, we'll go ahead and move on to administration. And our first agenda item will be to discussion and update presentation by Workforce Solutions Borderplex. And so we do have Leila Melendez here, who is the CEO of Workforce Solutions Borderplex, and she's going to be providing a presentation on the activities for fiscal year 2026. And so we're going to bring that up for you right now, Leila.
Hi, everyone. Good morning. Good to see you all. For those of you I don't know, I'm Leila Melendez, the CEO of Workforce Solutions Borderplex. We're the regional workforce development agency, and we serve the 6 counties in far West Texas. Good to see you all. So this is our annual report, and I'm glad that there's judges from some of our counties here, but also representatives from El Paso County and the city of El Paso, because I presented this already to Judge Samaniego. I will be presenting this to Mayor Johnson in the coming weeks. And so this is an opportunity to present it to you all as well. This is our proposed operating budget for fiscal year 26, which will begin in October 1. So I will just run through a few slides, let you know where we are financially, fiscal, and what we are planning to do with it.
Leila,
Yes,
is
ma'am.
that okay? I'll have you sit here.
Oh,
Just
okay.
make sure they can hear you.
Okay.
from-
Okay, great. All right. Can everybody hear me? Should I start over?
No, you're.
Okay, okay. Okay. So this is just a few slides, but I'm happy to answer any questions as we go along. This one is just a little bit of history as far as our revenue every fiscal year. We're fortunate that we are actually growing, and I'll talk a little bit about that from this year. This year we were at $72 million. Next year we are projecting for $84 million. And we'll talk about it a little bit more, but the reason for that is we are actually going to roll over some savings from this year that we are not spending into the next year, and that's all for childcare. So I will talk about that a little bit, but that's why we're showing more revenue being utilized in FY26. Oh, okay. Next, okay. So this one just gives you a breakdown, the same number at the very bottom as far as our total revenue, but on the left, it tells you what those revenue sources are. 67% of our budget is about $68 million of it is all on the child care block grant. So we spend approximately $68 million a year to support about 6,000 children in care. So when individual families are enrolled and become eligible, it is income-based, household income-based. So if they are eligible, then they are committed to a year's worth of subsidized childcare at the childcare center of their choice, granted that that childcare center is contracted with us and will accept that subsidized parent. But that parent must be provide at least 25 hours of participation in either education, training, or employment, or a combination of that. So we manage that entire system. So we pay about $68 million worth of that cost. That ends up being sorry, the numbers are wrong. about 6,500 parents and a little over 7,000 children. So more children, obviously. The other grant that we have is from the Department of Labor. This is a grant that we get, a competitive grant that we won in 2024. It's only for a couple years, and so that will be ending in 26. We also get about $11 million of workforce funds. This is the other side of the house where the majority of our innovation and workforce development happens. In this fund, we are getting a cut. Some of those programs are being cut through this administration just slightly from 12 million to 11 million. We also have workforce non-formula. These are other entitlement programs that we manage a little under $3 million. We do get local or private grants, philanthropies, corporate companies that are interested or help us offset some of our costs that are aligned. The mission is somewhat aligned. So a lot of these grants are to support youth or to support adults into workforce development. And then we also received some grants from the city of El Paso and the El Paso County as from the ARPA. And so those were targeted towards childcare and other workforce initiatives. So those contracts will end in this year. And so we are seeing a smaller amount of that in 26. And then lastly, we have a partnership with Vocational Rehab. This is the division of the Texas Workforce Commission that hosts or is the employees of the Vocational Rehab Department. These are employees that serve job seekers with disabilities. So we share office space with them. So they pay us and then we pay for their lease space. So we host them. Next slide, please. This is where we are going to spend our money, where we allocate it to. So at our headquarters, we actually have a decrease in our headquarters. We are saving about 9%, from moving from 7 million to a little bit less than 6.5 million. We have, because of the changes in funding and the uncertainty with funding in the future, we have had a hiring freeze since January. We are savings on some real estate costs and some equipment costs. So we were able to find some savings there. We also saved some on our facilities. The other offices that we lease, the services Okay. All right. Yes. Can you all hear me again? Okay, great. We have a small line item that says to be developed. This is like our escrow. These are grants that or funding that we have received or that we have saved that we can reallocate, but we haven't yet decided exactly what program to put them into. So we just hold them there for a little bit until we put them into another category. Childcare, again, you can see the largest portion of that. We are going from 48 million to 63 million, about a $15 million change in that. Healthcare workforce, this is a contract that we have in El Paso for a workforce intermediary. They are called Project Arriba. They are very similar to what we do, but they provide very intense and direct service to a small population of individuals that are strictly in healthcare occupations. So we basically outsource that to them. And they do a fantastic job. And then we have other workforce services that we provide through our job centers. This is a contract that we have with a provider. And then we also have a small contract with Big Brothers Big Sisters in El Paso to provide some case management and some support for at-risk youth, a small group of at-risk youth into paid internships, if you will. So they are providing that entire support system and then placing them into temporary internships, paid internships. This year, what we are doing a little bit different is setting aside, and you can see that $3 million difference from workforce services looks like a cut, but we actually dedicated that to something we are calling New Force Apprenticeship. This administration is very big on apprentices, which is another word for work-based learning, work study, internships, what have you. So we are just carving that out, dedicating that $2 million, and that will serve approximately 100 people over the year for work-based learning assignments where these are students, where they're students just graduate, maybe perhaps high school, just graduating high school, community college, university, but then they're also working. So we know that a lot of students work when they are going to school, but they are not necessarily working in their field of study. We will find them an opportunity to work in their field of study. So we pay for those wages for that short-term time. And then we have a set aside for what we call participant direct. This is the cost of, in addition to school and training, we might pay for tests for a certificate or work boots or safety glasses, what have you, transportation, and other things that they might need. So our entire, this is just an allocation, but you can see 79% of that is all related to childcare. Another thing we do with about $3 million worth of our childcare actually goes to the childcare providers. We provide professional development, material supplies, support, even wage supplement for their workers. So we spend about $3.5 million on the provider side, not just the parent side. Next slide, please. This is just a number to show you how many people we serve each year. Children served, we had a decline from 24 so far through 25, but this is only because this number goes through March of this year. So we still plan to serve close to the 8,000 mark. And then in employment services, these are the people that may or may not be coming through our front doors. We serve them virtually as well. We also have a program for non-custodial parents. We have a person that works at El Paso County and they work with the family court. And this is funding and support for individuals that need a job in order to pay their child support. So we actually can pay for their training and pay for them to work for a short term, because that's what we want them to do, is to help them find a job so that they can pay their child support. So we've served about 73 people so far. We help individuals that are on SNAP, there's a portion called employment and training. Some of those SNAP individuals, in order to maintain those benefits, have to be in school or looking for a job, and we help them do that. The same for the TANF choices, which is your welfare to work program. And then the last three are federal workforce programs, either adult low income or somebody that has been recently let go due to no fault of their own, or an at-risk youth that is not working or going to school. Those last three, we can help them pay for training, tuition, and employment. So, and then we also serve employers on the other side. We match them with the talent that they are looking for. Next slide. This is how we do this work. So as a organization, Workforce Solutions is a nonprofit. We only have about 53 employees ourselves, back office, administration, strategic planning, etc. But per federal and state regulations, we have to outsource the direct service to the clients. So the individuals that work at our offices and serve those clients directly have to be contracted out. So we have three large contracts. The first one is with Grant Associates. They are the staff that work at our workforce centers. They are an incumbent contractor. We procure these every 4 years. Just went through that process in the spring. We decided to keep them. They're doing a good job. That contract is about $11 million. We pay them about $5.5 million just on that operations, but then they pay the wages for individuals, they pay the cost of tuition, they pay all of that support service. So they're a pass-through of those funds. So their total contract ends up being about $11 million. And then we have two different contracts with the YWCA of Paso del Norte. The first one is for parent services. This is the labor that they do to enroll parents and place children in care. That is $4 million. And then the big contract is the payment provider. They process the payments to the providers. That's just a pass through of money. And so that's about $55 million. And we will, some of those are new contracts. Some of those are either in their third or second year of renewal. What we do every year is we evaluate where they are, if they're a renewal, and we take all of those contracts to our board of directors. We basically re-vet them and make sure that they are meeting standards. And if so, then we renew them. But that's done by action of our board of directors. Next slide. These are some priorities that we are keeping an eye on for FY 26. First of all, legislative changes. There is a proposal under that Congress will consider when they come back called a Stronger for Workforce for America Act. This is our preferred model, as most changes are aligned with the existing existing system. There are some changes that might hurt us, but primarily the majority of the changes will actually benefit us, I believe. But we are going to be asking for mayoral advocacy through the Conference of Mayors to support that movement. So we're part of a national Conference of Mayors Workforce Development Group. So we are keeping an eye on that through there. The president did propose a program called Make America Skilled Again. There's no legislation for this yet, but that proposed budget eliminates all 11 federal workforce programs and creates one with a 10% reduction. And it also eliminates funding for specific populations, including adult basic ed, like the GED program, program for individuals with reentry coming out of the criminal justice system, national emergencies. We actually have that $5 million grant that ends this year. We obtained it as a national emergency because of our transitioning soldiers out of Fort Bliss, and then also funding for youth. So you've seen the changes for Job Corps, and also proposes funding through local block grants. So not sure, we're keeping an eye right on what the appetite is of Congress. There's one that's already written, one that has yet to be written. We're following along to see what the appetite of Congress is on it. As far as our brick and mortar offices, we are looking at smaller offices targeted towards specific populations so that if we don't have direct funding for them, we can still somehow serve them. And then also considering partnerships with local nonprofits. We currently have a partnership with in El Paso called Project Amistad. They serve a lot of local low-income individuals. We have offices at some of our libraries. So where we can sprinkle out and improve access around the community, that's what we're looking at. Also maybe considering the food bank, because individuals on SNAP are already there. So those are the things that we are working on with our partners. Next slide. For our rural budget, we don't necessarily set aside a specific amount because anybody that needs services can obtain them. So we don't set aside any minimum or maximum, but we have been increasing our commitment and our investment in the rural area. So right now we are at about $1 million, but just so you see what different counties are receiving the level of investment and what percentage. Operations, we do have offices and we have staff that serve out here. We have an office in Alpine and one in Presidio. And then we spend about close to $300,000 on individuals that either have cost of tuition or supply or equipment. We have a few individuals that are enrolled in our childcare program. And then we spend about $25,000 to help local childcare providers provide services. And then you can see the amount per county of how we are, where we are investing that. And that $1 million, we've done quite a bit of programming in Brewster County with Sul Ross and Big Bend Medical Center. Next slide. So currently, we have several programs, and this is just a few. We currently have a program for nursing pipeline. We are sponsoring 7 nursing students at Sul Ross, and they are all, I'm not sure if they are all working or they all, we hope that they will work at Big Bend Medical Center, but it's a partnership. It's a combined funding partnership. So Big Bend Medical Center also contributed to that. We also are just setting up a program called Healthcare Certified Medical Assistants. This is in partnership also with Big Bend Medical Center and Odessa College. They're going to be providing the training. We are launching a apprenticeship program with Big Bend Telephone in partnership with some of the local ISDs to get those students into those jobs. And then we have summer work-based learning for several students working with local government and nonprofits. And then we are starting a victim advocacy training in Hudspeth County. It's an online course that they are taking. So we are supporting just a broad range of different projects. Next slide. That might be it. That was it. That's all I wanted to brief you all on, let you know where our money is going and what we're doing. Happy to answer any questions. Yes. Yes. If there are individuals that that are interested in that, we can support that. Yes. Yes, ma'am. So that is, it's always been a challenging program. So there's a difference between currently the federal legislation of what the program allows and what the state allows. So there's a difference of opinion and policy and in rulemaking. So we've just have had difficulty with historically individuals that are on SNAP and TANF that want to that can and they're what they're called able-bodied and they should be going to work. So we are serving them and we place them into programs, but the requirements are a little challenging for them. And then we can only spend, according to the state, we can only spend it on short-term training, but short-term training doesn't necessarily move the needle for those individuals. Short-term training, we want them to get into training that is a little bit longer term, credential-based skill, that really does elevate them out. So it's been a challenge for that. We're seeing some movement in the HHSC's department to partner with workforce agencies and make some modifications to that. Part of that is like the partnership with the food bank, doing like enrollment for the benefit and enrollment into employment kind of at the same time. So there's some movement on there. But I think that that's actually something that we are going to lead with. And I want to give an example. Short-term training, that's a state policy, state rule that says it needs to be short-term training. Our Project Ariba students, they're in a degree program. They're in a bachelor's of nursing degree program. And we know, I mean, their results are just phenomenal. It's not considered short-term. I can't pay for it, but most of their clients are on SNAP. So we want to use our SNAP dollars to pay for those students, but it's not short-term. So therefore it doesn't qualify. But we have actually been advocating this for about 5 years, and the state just this summer gave us the green light to pilot that. So we are going to be using our SNAP funding to pay for SNAP enrolled individuals in degree programs with Project Ariba. And I know it's going to work. I mean, we see the numbers, it works. So maybe that will nudge the state a little bit to do something different. So, yes, I think that what's very difficult for me to explain is what the president's priority is. He announced the Make America Skilled Again, but there's no legislation around it. And the current legislation, which is why I come to you and present to you, is because each judge of our service area, the lead elected official for each of our service areas, you're responsible for your economy and jobs, right? So you have a say in the workforce system, which is why I'm here. I work with you all. The new legislation or the new the Make America Skilled Again is proposing that like money be sent locally, and so we don't know if that means there may be redistricting of the workforce boundary areas, consolidation, whether states take it. The state used to run workforce systems, and then they created boards. We don't know if it's going to go back to the state. I don't know. There's no legislation for it yet. But I will definitely keep you all informed, because you might need to decide whether you want to support or oppose that. Right now, you have a say in that and a responsibility towards that. But I don't know whether that will be removed or not. It's just, there's just nothing to go on, but that's what we are very closely following. A Stronger for a Workforce for America Act keeps it kind of status quo. The Make America Skilled Again, have no idea. It could stay exactly the same. It could completely blow up. I'm not sure, but I will keep you all informed. Okay. All right. Thank you. Yes. Yes.
So you had mentioned the David Carrasco job.
Yes.
Posting there. Now, what would be the net effects to your funding and how that's allocated?
So that does not come through the workforce boards.
I
It,
understand.
right.
What I'm saying is, say they close. completely.
correct, yes.
That completely different entities. different
Right.
funding. But how does that change the outlook from the?
It just makes it more challenging because we have in El Paso County, about 14,000 out of school, out of work youth. That's that's a tremendous number. That fluctuates a little bit because sometimes they work, sometimes they don't. Sometimes they go to school, sometimes they don't. So sometimes they're in that number, sometimes they're not. But if you go back, if you can go back to my slide, and one of those WIOA, the Workforce Innovation Opportunity Act line items for youth, it's really small. Let me, can you go back a few slides? More. No, it's right here, right here. Slide number 3, please. Right there. Workforce formula, that $12 million is a combination of adults, which are individuals over 25, low-income individuals, dislocated worker, and then a small amount for youth. So that the total dollars that we end up using for youth is at best maybe $3 million a year, but that is not enough to serve all of those individuals. So we've been partnering with the Job Corps to try to support them. They'll just we could enroll them. They qualify under the same, they get the same exact bucket of money. It just goes to them directly. So they qualify. So they would qualify for this number. So that their customer base ends up being in mine, and then now it's just diluted. Yeah. So it just makes it harder to spread that out. Yes, ma'am.
What is the status of the Job Corps right now in El Paso?
I believe they have the last action from the judge was that they can continue through. I'm not sure if it's not necessarily July, but through September, perhaps. So like maybe through the end of the fiscal year. But I anticipate that over the summer and conversations that are happening, I do anticipate that they likely will end that program. And then where if their funding gets moved to workforce boards, perhaps I just really don't know. I just know that they're right now operating on a really thin line, and our support of them was let's quickly put these folks into jobs so that they can start earning income, they can start paying for housing. That's the most important thing. You're welcome.
They reached out to, so I know that they reached out to a couple of people. So I would just, ask that members here really support them, give them a call, and ask what they need from us. Letters, whatever it is.
Right.
We really need to push that.
Yeah. And I think that the challenge with the Job Corps, right, is that and even we face this challenge as well. Employment is necessary, but it's not always the first thing. They need a lot of other support in order to maintain that job. So that's the cost of the program, is helping an individual stand up and stay standing and sustain that so that they can keep that job, not just get the job and then lose it next week. They need to be able to keep that job. And especially with at-risk youth, they have a tremendous amount of barriers that make it really easy for them to just lose jobs. And here we are back again. So that is the biggest challenge. You're welcome. Thank you.
Any other questions?
All right. Thank you.
That's it.
Thank you all for your
Thank
time.
you.
Appreciate it. Thank you. Thanks, Annette, for letting us.
Thank you. Thank you. And the other two, you may want to hear the presentations, because I think there might be some. All right. Okay, well then we'll go ahead and move on to agenda item 5.2. And before we do, I just want to briefly say that oftentimes we have quite a bit of informational items for you all as opposed to action, but our organization is a great opportunity for regional collaboration forums, things of that nature. And so I just wanted to just be mindful of why we bring these forward to you, because it's a great opportunity for these organizations to be able to get the word out at once to many entities. So with that being said, we do have Marisela Tavares, and she is with the Recovery Alliance. And so you're going to be receiving a presentation from her organization where they talk about the Narcan distribution hub program, and she is their hub project coordinator for Region 10. And so Marisela, would you like to go ahead and make your presentation?
Yes, thank you. Good morning, everyone. First, I'd like to start off by thanking Annette for the opportunity to present here today. So my name is Marisela Tavares, and I serve as the Naloxone Distribution Hub Project Coordinator for Region 10 with Recovery Alliance. I provide overdose prevention and response training, and I distribute naloxone, also known as Narcan, to both organizations and members of the community. My goal is to educate as many people as possible on the importance of carrying naloxone and knowing how to use it. Here at Recovery Alliance, we serve people affected by substance use disorder, and we also serve the unhomed. Our services include peer support, community street outreach, in-reach with the jails. We do have a 90-day recovery program for both men and women. If your organization or someone you know could benefit from our services, please reach out to me. I will drop my information in the chat. Thank you again for your time. It's a very brief introduction of myself and my organization. Does anybody have any questions?
And I don't know if there may be, as you all are working with your first responders or law enforcement, if that's something that you all would want the Recovery Alliance to meet with and talk about what services are available through their efforts. But we definitely will provide you with Marisela's information, and then we can follow up with your entities if you'd like for us to do that for you. Okay. Okay.
Thank you so much. In our training, we could do it over Zoom or in person, and it's an hour-long training. It's a lot of good information, and thank you again for the opportunity.
Thank you, Marisela.
Thank you.
Great. Okay, so we'll go ahead and move on to agenda item 5.3. And this also is a presentation from the Executive Director of the Big Bend Regional Hospital District, Lynette Brem. She's here in person with us. And Judy, I think you're going to be able to pull up the PDF slides if that's possible. As Judy's doing that, Lynette was previously the grant administrator for a USDA contract that was received by the district. And I think they were able to do some really great things. And so the time that I've been able to interact with Lynette, I can tell that has a great vision for the district and what she wants to see going forward. And so hopefully we can be a part of that through the council governments or individually as entities. So Lynette, I'll turn that over to you. You can stand here. That's fine.
Good morning,
Or you,
everyone.
and you can actually sit here and you want to just project your voice.
Yeah,
and make sure we get.
Absolutely. So I appreciate the time, Annette. My name is Lynette Brem. I live in Presidio, but our hospital district, as you know, represents both Presidio and Brewster County. So we have offices in both areas. And I just kind of want to give you a little background. I don't know how long it's been since y'all have had a presentation from the hospital district. So just kind of some reminders of the services that we provide and opportunities to collaborate. Do you want me to? Or she'll do it? Okay, next slide. So we do get confused sometimes with the actual hospital that's here in Alpine. We are the hospital district, so political subdivision, and serving particularly the needy inhabitants of this community. But we also have a larger initiative to really provide public service, health services to the larger community. Sometimes we get confused with the clinic, the hospital, the Affordable Care Act. We're not that, but we also go by a few different names. Big Bend Health, which is the heart, and then the hospital district, or BBRHD. We kind of go by all of those three terms. It's the same organization. Next slide. So what we do, we pay for the medical bills, ER bills, dental and vision bills for our county's most needy individuals. So if someone comes to us and they need to go to the ER, they're having an emergency, we will pay for that bill. If they need a surgery, they need a knee replacement, a colonoscopy, we will pay for that as well, as long as they qualify. Up to $30,000 is the annual cap. Next slide. So next slide. So who qualifies? So this brochure that we hand out kind of gives you an idea. So if you think about your communities and who you serve, this is who would be able to potentially be a part of our program. They do have to live in Brewster and Presidio County. And they cannot have Medicare. So anyone 65 or older would not qualify for our program. They would then go into Medicare. But if they're between 18 years old and 65 and they make less than, actually that's not updated, it should be about $1,923 per month. So our qualification is actually at the 150% poverty level, which is very, very generous. There's other hospital districts that are at 20 and 50% of the poverty rate, but we're 150%. So that's a fairly wide net to capture people that might be working part-time jobs. Next slide. So we also provide other initiatives for the public that you don't have to qualify for it. One of the things that we recently did was we brought a mammo-mobile back here to Presidio and Brewster County, and we were able to provide mammograms for about 200 women. And the mammogram came and was here for 5 days. They went to Presidio, Terlingua, and Alpine. Next slide. We also, as Annette, we do apply sometimes for federal funding. You know, our operating budget, we're a small organization. We're 6 individuals with a very large territory. Our operating budget's only about $2 million, but with this USDA grant, which expands our reach, it's about $4 million. We've been getting about $2 million from them every year. The total award is 7.2 with 5.5 million of the dollars for taxpayer money from here locally. Some of the programs that we're able to provide with this grant money is a new community paramedicine program. There on the left-hand side, you'll see the little Equinox. So what this program does is they actually go to a person's house, and it's staffed by a paramedic, and the paramedic will make basically a house call and be able to do blood pressure checks, medication management. They'll be able to do follow-up on doctor visits. You know, if that person had recently been in the ER and they need to just be checked, maybe to make sure their wounds are healing correctly. It's a wonderful free service that the USDA has paid for. In Presidio, they have seen over 1,000. They've done over 1,000 visits in the last 2 years. So it's a very popular program. It's well used. And then there in the middle, the program has also benefited Terlingua. And they also started a new community paramedicine program and got a wonderful kind of mini ambulance there that is able to go off-road where their ambulance cannot go. So the program also paid for that. And then the med van down at the bottom is the one for Presidio that also was paid for. The USDA grant, we're getting a lot out of this USDA grant. It also paid for partially paid for the new clinic in Terlingua. So we are helping to subsidize the telehealth in the new clinic in Terlingua. So a lot. Unfortunately, it does go away at the beginning of next year. So if the programs can self-sustain, then those programs will continue. But if they can't self-sustain or we can't find other funding sources, then unfortunately they will go away. Any questions on this? As I said, there's a new clinic that's open in Terlingua that the hospital district is helping to support through the USDA grant. And there's a new clinic in Presidio that we're also helping to support through telehealth, through some grant funding that we have for telehealth. Both of these new clinics have a really strong telehealth operation part to their operations. You're able to go into the clinic, you're able to see a nurse practitioner or a nurse, and then a doctor comes on video, and it's a great experience. The feedback has been very positive. So the hospital district is helping to support those. Next slide. We also have a pretty healthy fund balance. And so the board has decided to invest some of that fund balance into a new facility in Presidio. Presidio right now has the FQHC and it has the new telehealth clinic. But beyond that, we really don't have our permanent office space or clinic. So this new facility is going to be right across from the PAC, the library. And it will have offices. It will also have community space, so we can have collaborations with groups like that presented today, that we can do more to serve the community than just for the needy habitants, but we can serve the popular at large. So that will probably get under construction maybe as early as May of next year. Next, is there a next one? Oh, just some other programs. We have some other kind of fun programs that we provide. It's called Mejor Salud, which means better health. And it's just helping individuals take more care of themselves, to do some more preventative care. So we offer some fitness classes, nutrition classes, diabetes awareness classes. They're just whatever the community, we think the community could benefit from. We offer that as well. You can go to the next slide. That's the nutritionist. She speaks English and Spanish. That one's in Spanish. Next slide. Walkathon, just lots of events that promote better health. And I think that's the last one. So do y'all have any questions or anything that else you'd like to know about the hospital district?
I do want to say that there was a void that had occurred with the mammograms, especially within El Paso. Desert Image would come out to Presidio and this area. I did believe I'm not sure it was only Presidio, but I know they were coming out here, and when they could not come anymore because there was some legislation that had occurred. So everybody was in a quandary on what to do. So I'm very excited to hear that that's come back. But I'm thinking that maybe there's even opportunities where perhaps when you all are doing your services or preparing for that, maybe Jeff Davis would want to maybe tie into that, maybe Culberson Hotspur, so that way if there's any coming from El Paso, they could have their scheduled events coinciding with yours, so they could do all one swoop and be able to maximize on that funding.
Yeah, we can definitely help coordinate that. They like to come out for a week, do 1 or 2 days in each location if there's enough demand for it.
Thing that Mark.
Okay.
We're on the list.
Okay, that's
Presidio, Alpine, and Terlingua.
that's true. Marfa wasn't there. We'll add him in for next time. I think we're gonna plan for early of next year. I have to get that funding spent by March. So probably January of next year. So we got some time to plan.
So are they coming out of El Paso?
Yes.
So perhaps we can, when they're scheduling that, we can look and see if we can find some funding for Fort Hancock, Sierra Blanca.
Okay.
And then Judge Diaz, we can see if perhaps if Culberson already has this service and need fulfilled, then we're good. But if you don't, then maybe they can find a way to make a stop there as well, perhaps. Okay. All right. Any questions?
I do just have one more thing. We are doing a mental health first aid training. So you can get your first aid training for CPR. You can also get your first aid training for mental health. So if anyone is interested, we're doing 2 sessions. You get a 3-year certification, and it's in Presidio and Alpine. So anybody that would be interested in signing up for that. please
And
consider.
that's only for the residents of.
No, this is for anybody.
Okay,
Yeah, this
so
is anybody.
any of our region.
Yep.
Okay. Thank you, Lynette. Appreciate it.
Thank you. Perfect. Thank you.
Okay, so for those who are joining us online, if I can make sure that you all have your camera on, we do have a few action items too. So I just want to make sure that we have okay, thank you so much. So our next item to present, Commissioner Holguin, will be item 5.4, and this is to approve and authorize the appointment of the new Rio Grande Council Government's second vice president. And as you all are aware, this item we had tabled in May, and so we brought it back to you all. And as a reminder, former Alderman Cantu from City of San Rosario had lost his re-election bid in May of 2025. So we do need to fill the second vice president position, and this is at the discretion of the president and the vice president, and it does require your approval. So I'll turn it over to Commissioner Holguin.
So my recommendation would be to nominate Representative Lily Wong of El Paso.
Seconded.
Okay, all in favor?
Aye.
Thank you.
Those online, we're good? Did we get our thumbs up? Yes, okay, thank you. All right, okay, then we'll go on to agenda item 5.5. Oops, let's see, I skipped Okay, we're okay. Mhm. All right, so agenda item 5.5 is approve and authorize the executive director to negotiate and execute a contract not to exceed $10,000 with Diane M. Harvey, the sole proposer to the request for proposals for the abbreviated mediation skills training to develop an accelerated mediation skills curriculum that includes providing on-site training subject to legal review and approval. And this agenda item, we did have this as an RFP in May. We did only receive one proposal. And what we're asking to do here is for you all to allow us to go ahead and execute that contract with Ms. Harvey after we meet with her. We don't anticipate the cost to be more than 10,000. We think it'll be actually less than that. And to ensure that we have some training available before the end of this fiscal year, we would like to be able to have that flexibility to execute the contract within this time frame. And if there are any questions for me, I can answer them right now at this time.
This is training.
We would want to do our first training in September, and that would be for specifically for El Paso County Human Resources staff. And then once they'll be our first audience per se, and then from there, in coordination with Marisa Quintanilla, who's running the program, we can look and see when the schedule will be available for others. So we are under the Dispute Resolution Center. Obviously, mediation is what they do. This is what they provide. There was a request from El Paso County Human Resources for us to look at the possibility of abbreviating that training just to give some essential skills for conflict resolution. And so we went ahead and we went forward with this, and we wanted to get a trainer out there to do that for us.
Everything that I experienced.
You would be one of the ones too. Yes, sir. Okay, you would sign up. Yes, sir.
All in favor?
Aye. Aye.
Any opposed? Okay, all right. And the motion will carry. Thank you. All right, so then our last item under administration is to approve and authorize the formation of the Rio Grande Council Government's nominating committee for fiscal year 26. So we can look at who we're going to be. We would ask the nominating committee to be able to present to us a slate of officers as well as directors within the board of directors forum. So we would like to have at least 3 representatives if possible. This would be where the committee would present their slate of nominees at the September annual meeting, which will be on September 26th at 11 a.m. And it'll be at the El Paso Community Foundation. Are there any takers?
Are you asking for volunteers?
Yes.
Do we have any volunteers to serve on the nominating committee? So we
Okay.
have Representative Fierro, Representative.
Only one, I think,
Oh.
if you're going to be an officer, yeah.
Okay.
Mhm.
So Representative Fierro. Any other volunteers? Mayor? Okay, Commissioner? Okay,
Okay.
we have Commissioner Butler.
And I had, Mayor Anthony, did you raise your hand?
No,
We can
Mayor
do 4.
Baeza.
Okay, Mayor
Oh,
Baeza.
do you? How many do we need?
You need
I mean, we,
2
3.
from the county and then 1.
Yeah, we're so lucky when we get at least 3, but if we have 4 that would like to, I think it'd be great. Okay.
Okay, so then we have both mayors, Commissioner Butler and Representative Fierro.
Yes.
Okay.
Okay.
Anyone online who wants to volunteer for the committee?
That silence is no.
Okay. I thought maybe everyone was just muted, but okay.
Okay, so then we do have a motion. Do we have a motion?
Do we have a motion to accept those 4 members to the nominating?
I don't move.
So we have a motion and a second. All in favor?
Aye.
All right. Okay, great. Thank you so much. The motion is approved. So we'll go ahead and move on to regional services with Marisa Quintanilla. We are going to receive a presentation on the Community Emergency Response Team Program. And Marisa?
Good morning, Board of Directors. This is an informational item. Wanted to go ahead and let you all know about an upcoming training that we're going to have here in Marfa. It is the Community Emergency Response Team Train the Trainer. And this is actually geared for those individuals that want to go ahead and become trainers to teach the CERT basic classes. Now, one of the good things about this is that if you are a first responder or a nurse, I was talking to Lynette about this. If you're a first responder, you can go ahead and just take the 2-hour online course, IS, and I think it's the IS 317. And we would be, the COG would be your sponsoring agency. You can go ahead and attend the Train the Trainer. And so it's a 3-day class. It's going to be August 12th, 13th, and 14th here in the Kastner room. And then once we have built up that capacity for our trainers, then those trainers in each of the jurisdictions can go out there and then form and get students or citizens to participate and make up that CERT team for your community. So we did reach out to a lot of the EMCs and then also first responders within the region, see if they want to go ahead and become Train the Trainers. So it's just not only for the region, but also from folks from El Paso if they want to come into Marfa and take the training. So we're going to be hosting that. I think this is a great opportunity to build capacity in community preparedness. Not only in El Paso, but as well in our surrounding jurisdictions. Behind the agenda item, you do have the flyer. And if you do want to sign up, you do need a SIT number. We will help you register for the SIT number. It's just TETM, the Texas Emergency Management requirement. But we reached out to Sam. I think Sam's going to get, either he's going to come or somebody, same thing. James is teaching the class. And so I encourage folks, if you're a first responder, to take advantage of this opportunity.
How many participants are you anticipating?
So right now, we're looking at maybe no more than 15. If each jurisdiction sends 2. So I know Jeff Davis, I talked to Judge Evans, I talked to Sandra on Monday, and her and maybe Peggy Moats might be attending, or maybe another one as well.
Right.
So we get 2 from Hudspeth, Culberson, Jeff Davis, Presidio, and then from Brewster County. And then we already have 3 folks from the outside, other entities that have already signed up.
Okay.
So that'd be great.
I was just asking in case you need a bigger venue, we can let you. use
Oh,
the-
that's right. Yes.
use The Ambeth building.
Yeah. And then, right. And then I also talked to Chief Carrillo as well. So he's going to send some folks as well. So
Okay.
Yeah.
Just in case.
yeah, I'll keep that in mind.
Yeah.
Perfect. Perfect. Questions? Thank you.
Thank you.
Thank you.
All right, our last agenda item is from Yvette Lugo, our Area Agency on Aging Director. She's going to be providing us a presentation on the 2025 Aging to Perfection Expo. And Yvette, you want to go ahead and talk about that?
Yes. Good morning again, Board of Directors. Yvette Lugo, Director for your Area Agency on Aging. This obviously is also an informational item. Just wanted to bring forth this information to you, especially for our El Paso County participants, but everyone from the region is welcome to come into town and join us. This is our 24th annual Aging to Perfection Expo. Mario made reference to that in our enterprise fund. But this activity or event for us is our way of bringing together all of the resources in our community, of course, that support the needs of older adults, family caregivers, adult children caring for aging parents, anyone who's thinking about aging, which technically is all of us, right? We bring together all of these resources on this one day that's happening August 20th from 9 to 2 at the El Paso Convention Center. It's a free event. Again, different informational booths, health screenings. We also have educational sessions, and those 2 are listed there. The first one is being brought to us by University Medical Center. They've just recently received an age-friendly certification. They've got 3 geriatricians on staff. And so that's important when we think about older adult health. And as we age, we're not better than to think of people who are specifically trained in looking at geriatric healthcare. And so they're going to talk about the importance of our aging. It's not a joke. We're all aging, and that's a good thing. The importance of learning about mobility devices, fall prevention. Sometimes we think, and they've reported to us that they've seen an increase in emergency room admissions because people are all using rollators. Those are those things that look like walkers. They've got a chair, thinking nice and convenient, right? If we need that. But if we don't have the upper body mobility strength, that can get away real quick. And that's resulting in several emergency room visits. So it's more of an education on what's appropriate and how we need to use mobility devices to help us. The other presentation is our local FBI El Paso field office. We'll be talking about all of the cybersecurity or cyber-enabled, fraud that is affecting and can affect older adults, but some of us also can fall prey to that. So aside from the information booths, health screenings, education sessions, my favorite part is the entertainment. And that is all purposeful, older adult performers, singers, dancers, people that showcase that aging is a good thing and that we can all stay active and age well. And so we ask that you come out and see us, join us, come out and see what you can learn. If anything, just to come out and say hi and support our event. We usually have about over 2,500 people that attend. We purposefully bus in those participants at our El Paso County senior centers. We contract charter buses to do that. So you know when those older adults arrive because they're all there. I know Congresswoman Escobar said she wants to come by, and so she'll be having a little time on our stage to address the crowd. But more than anything, again, this is our way of just bringing together everything to support and show that there are in fact resources and the commitment to showcase that we are supporting older adults as we age. So again, just an information item, but if I can answer any questions, happy to do so.
Will you forward us the PDF of the
Sure.
flyer so that we can share it with our neighbors?
Absolutely, yes.
Have are you already at capacity for vendors?
No, in fact, we still have, if there are those kinds of entities that would like to participate, have them reach out to me or we can talk after.
Well, any other questions? Thank you.
I have a comment, one and a question, and I don't know if you would be interested. The city has 10 different mascots from Leah, the reading, the library mascot. Would you be interested in having some of those throughout the day as part of an entertainment? I think some of you would like to have their pictures taken with them. I'll get together with you.
Yeah. Okay.
Okay.
Thank you. All right. Thank you, everyone.
Thank you.
All right. Okay, then we're now at announcements. Are there any announcements to make? I do want to just announce that last Friday was the grand opening of the health clinic in Jeff Davis County. This great initiative with Texas Tech University out of Lubbock, as well as Texas A&M. Lubbock will be providing the healthcare portion of it. Texas A&M will be providing the mental health of that initiative. And just wanted to say congratulations to Judge Evans. I know it's been a long time coming.
We were very excited. Residents, the insurance, we will take it. It is not only for Jeff Davis County residents. We will take whoever comes in. There will be a sliding scale if you don't have insurance. We are also going to have programs to sign people up for free insurance if you qualify. So this is a great start to getting more healthcare in our area and our rural area. So.
Congratulations.
Real excited. Thank you.
Any other announcements?
Oh, the other thing is, this is the very first time Texas Tech and Texas A&M have ever collaborated on the same project and benefiting a rural area. So.
You're on the map.
Yes.
All right, well, it looks like that is the end of our agenda. Can I have a motion to adjourn? All right, so meeting adjourned.
All right. Thank you, everyone. Thank you online. We'll see you in El Paso next, on September 5th. Thank you. Bye.